Good afternoon. It's the two wise birds, Sue Boynton and Jane Lelean. So, Sue, since we last spoke last Thursday afternoon, what's happened in the world of dentistry?
Wow. Do you know, I'd like to say we've had such a relaxing week and nothing's happened at all. And by Jove, that'd be far from the truth, wouldn't it? We had the second letter last Thursday after the first one that gave no intention of telling us that they were going to be opening. We had the second letter from the CDO in England saying, get ready to open on the 8th of June. Very short notice for practices. Now, today, we've just been chatting about the new SOP, the standard operating procedure that's come out for England as well. There's also the FGDP UK guidelines that came out on Monday, and there's new BDA guidelines for getting back to work as well. Wow! For practices and for individual dentists and clinicians, there's so much information to go through.
I know. And we've just
And
been webinar after webinar
yeah,
after webinar that we thought that we'd done a lot of webinars in the previous 10 weeks, but this week, phenomenal in amongst trying to access PPE, trying to access genuine PPE.
and I'm glad you mentioned that because that's a huge challenge for people. First of all, finding out who's got PPE, and even some of the regular suppliers seem to have inadvertently got the PPE that isn't the correct one as well.
Yeah.
And then there's the business of fitting and testing masks as well. This is a huge challenge for the profession. And don't forget, nobody's paying for this and nobody's helping us with it as well.
No. I know.
And in the meantime, patients are getting the message from central government, oh, good, dentists are open on the 8th of June and you can do everything.
I know. I think that dentists, in amongst all of that, the SOPs and training team members and working out how the team are going to come back together, who they're going to bring out of furlough, who they're not going to bring out of furlough, and all of that, managing patient expectations is like the icing on the cake, because I think that many people are going to think, oh my goodness me, dentists are open, business as usual, I can do everything. And they've now got all their PPE because that's what the government ministers are saying, only to be disappointed when we say, well, actually, no, what we're doing is prioritising on a basis of need, prioritising on a basis of risk, and whether we've got the PPE at all. And some people just still haven't got it, and certainly haven't had their masks fitted.
Yeah, absolutely. And then there's also the added thing that some people are going on courses so they can do the fit testing for masks and that sort of thing. And I'd just say to those people, just check that you've got indemnity that covers you for that. Don't assume your normal indemnity does. It may for some indemnifiers, and for others, it may be that the course provider can direct you to get some additional indemnity that covers you for that. But don't just assume that you're covered, because it's really important.
Absolutely. And talking about indemnity, do you not think it's appropriate that everybody is always checking with their indemnifier about what they're doing, their SOPs, who they are seeing, who they're not seeing, and particularly associates that are working for, it might be just one principal, it might be associates that are working with a corporate, that they have an individual responsibility to make sure that they and their registration is safe.
Do you know, I think that's a really good point, because I come across associates sometimes who think, so long as I'm following what the practice owner tells me to do and what the practice protocol is, I'm safe. And if something goes wrong, it will be a defence to say, well, someone else told me to do it. The law and the GDC sees associates as individuals who have their individual responsibility. It doesn't matter if they're employed or self-employed. They have their own responsibility. So if your practice owner is asking you to do something that doesn't seem right or you're not confident with, first of all, get some advice on that and then sit down and have a conversation with them on the phone, on Zoom, whatever. Don't just assume it's going to be okay.
So I've had a number of phone calls from people, associates that are being put under pressure to do things that they're not comfortable with. And I've got my take on it, but I'm curious, from your perspective, how do you think that people should manage it when they are, because pressure, fear, can be a great motivator, and we can take decisions that we wouldn't take when we were in a rational situation. So when associates are being put under pressure, how do you think that they should deal with it?
Do you know, that's a really good question, because I think there's people up and down the land now listening to that question thinking, yeah, can't wait for the answer for that because that's me or that's my friend. Now, the first thing to do is don't make any quick decisions.
Yeah, absolutely.
Think really carefully about it. And it's very difficult for people because don't forget they've set up home somewhere, that they've got maybe children at school, their spouse working somewhere, and maybe it's the only job they can get in that area and they need the job. So there's that pressure balanced against doing what's the right thing. And I will often say to people, think about how you could justify your decision in the future when you're looking back to someone else who's got the same knowledge that you had at that time. Can you justify it? Almost take yourself out of your own body and look at it as if it was someone else. Think of it as if it was your colleague ringing up asking you that question. You'd be saying, no, you can't do that, mate. You're going to put yourself in bother. Because ultimately, somebody could be putting their registration at risk, and we don't want to see anybody doing that.
I know. And I agree with you, and I get that it's just hard.
Yeah.
And I think we have to recognise that those emotions that we feel, yes, they are real, and they are also self-generated. That finding a way, whether you're bouncing it off somebody else to take the emotion out of it. And I often think it's quite useful to think that if the patient were your parent or your child and you weren't the dentist, what would you want? And they are often stark decisions, and I get that many people are going to be scared that they might lose their job, with all the potential consequences that go along with that. What happens if you lose your registration?
Yeah, and I think you and I have both helped people who've lost their registration as well, and we know how devastating that is. So what we're saying is no rushing into any of these decisions. Get some advice, think carefully, and look at how you could justify what you're doing.
Absolutely. And I think justification is so key, and also documenting our justification. Why have I decided? What is the evidence? And I do also acknowledge that I wouldn't go so far as to say that some of the SOPs that have been published, I don't think I'd go as far as to say they're contradictory, but I think there is some grey areas. They're just not as clear as maybe we would like. And I think it's really important that we're defining what we're following and why.
Yeah, that's absolutely right. And the way to define it in your own head, again, is how could I explain that to someone else? You know, would it be tricky for me to explain it, or could I explain it with some clarity? And that often helps people to unpick their decisions as well. But you'll never be criticised for being cautious and for seeking advice before making a difficult decision.
Absolutely.
So what good news have we got this week then, Jane?
What good news? Well, we have got some guidance.
Yeah.
What other good news have we got? I think, as I reflect, is that what I'm really, really enjoying is seeing how much the profession has actually come together and is supporting one another. I think as a profession, we're often very much in silos, in our own surgeries, head down, and we don't like to share. This is a generalisation, I get, it doesn't apply to everybody, but as a generalisation, we are not known for sharing ideas, sharing documents, sharing. But actually, in the last week, I have seen a phenomenal amount of sharing ideas, supporting one another. And I just think it's fantastic. And I really do hope that it continues.
That's a good point, and I think it will. And I think one of the reasons why we've been a bit isolated before is it's the way the profession's set up, the way we've had to work. We've not had the opportunity to do this sharing, supporting, mentoring. And now we've got the opportunity. I think it's going to continue, Jane, because I think we're going to have challenges going forwards. I don't think we're going to have a normal as the normal was described before. I think there's these difficulties. So I think we can take some positives from this today.
Yeah, absolutely. And I hope that when we move out of level 4, because we must still remember that we are at level 4. Level 4, which means the NHS is stretched, it can cope. And by the time that we can move forward into those lower levels and we can begin to meet much more face to face, I do hope that dentists spend more time face to face at meetings, at networking and sharing. I think it's brilliant. Yeah.
Excellent. So we're ending today on a positive note.
Yeah, absolutely. So, if you had a crystal ball, Sue, what do you think could possibly happen in the next 7 days? Dentists going back to work? What do you think could happen?
I think there's going to be some good things as teams get to see each other personally when we haven't done that before. It's all very well chatting on Zoom, but seeing each other personally is so much more supportive.
Yeah.
I think practices are going to have a lot of support from patients who are glad to see them as well, so long as they can manage those patients' expectations.
Absolutely.
And I think there's going to be a lot of information sharing when dentists and dental teams are saying to each other, how did you get on your first day back at work?
Absolutely. Absolutely. Brilliant. Well, I look forward to speaking to you next week. And for all of those that are watching and listening to these little videos, do please share your experiences. Let us know how it's been for you as you've gone back to work. And if there's any questions that you have, message us below, contact us directly, because the Two Wise Birds are here to help. See you next week.
See you
Take
next
care.
week. Good luck, everybody.
Yeah, good luck.